The materials brought to the sterile field. This seems to be the major problem. You know, trained staff has to be able to put sterile things on the field, because once it's contaminated, everything's contaminated. And this puts the patient at great risk. Improved patient outcomes. Well, we hope to reduce the mortality and morbidity rates, quality of life versus death. I mean, this is a major issue for our patients. And the length of stay, like I said, can be increased 7 to 10 days. And according to one of the articles I read, financial costs can be increased by like $41,000 for like a surgical procedure if they develop an infection. And if we reduce these infections, of course the patient's going to be the one to benefit. And then it comes back to the facility itself. When the facility is responsible for these infections, oftentimes the insurance will not pay a dime. So the hospital eats all of the cost of keeping the patient in a hospital, paying for all of the extra care that they're going to need. So solutions, the Joint Commission, CDC, AORN, and the National Center of Biotechnology Information. These are the people, among many others, that are working really hard on trying to reduce these infections. And one of the things that I'm recommending is that we not only use the recommendations of AORN, but we are going to follow them strictly. We're going to provide checklists for each nurse for each procedure, so she can check off that the recommendations have been completed. And then we're going to use evaluation tools to monitor this risk and do the improvements needed. And of course, education for staff and family are very important. ARN recommendations, hand hygiene. This is such a basic tool, but it's so necessary. We have to use soap and water and surgical hand scrubs. And it has to be done before donning your gloves. And we always have to follow the recommendations of the manufacturer. Aseptic technique. This is where, like I said before, putting sterile things on the sterile field has to be done correctly every time. And then the microorganisms. One of the biggest tasks of the nurse is doing the cleaning the patient and preparing them and prepping them for the surgery. And this has to be done correctly every single time. You have to start at the site, you have to move out, and it always has to allow time for drying. Education for the staff. I recommend that we do at least twice a year. We're going to have competencies for the staff. They can perform now the hand hygiene and placing things on the sterile field, and we're going to put poster boards all through the OR, and we will use these checklists, and in cases we're going to randomly audit cases for accuracy. Patient or family. The patients need to be given the written instructions. This is back to the basics. Verbal instructions, and they need to be given the opportunity to demonstrate what we've taught them, and if they have questions, help them so that they can take care of themselves. Personally and professionally, I took an oath to do no harm to patients, and I take this very seriously. Conclusion, with surgical site infections are improving, there's still a lot of work that needs to be done, because one is not zero, and that's the way we think at work. And I hope that we will all start thinking this. Thank you for your time.